Hello, my name is Abhishek Chandra. I'm a fourth year medical student here at the University of Minnesota, and I'm going to be presenting some research from the Department of General Surgery here at the university. So our research is focused on surgical education, specifically in the changing landscape given both the COVID-19 pandemic and the consequent limited access to the clinical environment for many medical students and surgical trainees in their initial years. And in light of this, surgical education has leaned further into medical simulation as a way of teaching critical skills to medical trainees. The goal of our research study was to develop a lower leg amputation simulator that could simulate realistic blood flow and blood pressure, allowed for an immersive educational experience, and was cost affordable and reusable for multiple trainees. We developed a pressure system through which we pumped artificial blood using a valve control and used low-cost materials to simulate and recreate the anterior tibial artery, the tibia itself, and just using PVC pipe allowed for medical trainees to actually perform an amputation on the model while also having to manage realistic blood flow. We were able to test this in a surgical skills workshop where we first had the model evaluated by 53 medical students who participated in a workshop that taught them the principles of trauma, surgical anatomy and instruments, and then allowed them to practice some basic surgical technique. For our amputation simulator, we simulated a tibial fracture patient, requiring the students to make quick clinical decisions, stabilize the bleeding vessel, and then using a giggly saw to actually amputate on the simulated model, as you can see here. We also administered a survey to see what their thoughts were on the educational benefit of the research model. Generally speaking, students found that it was a very helpful tool in helping them understand the lower extremity anatomy and becoming acquainted with the surgical techniques, specifically the use of the giggly saw. As a pilot study, the most important takeaway that we have from this is not only the future enhancements to the model, the iteration, and the validation steps that come next, but the promise for improving patient outcomes by allowing for dedicated practice for students, but also outside of medicine, increasing exposure to STEM opportunities and careers, and then access to life-saving skills training. Medical simulation is a growing field, and we're very excited to continue to contribute to it. Thank you very much for the opportunity to share a little bit of our pilot research. Thank you.